Today we're going to be talking about Marfan syndrome. What's different about these two individuals? Well, individual 1 has an average arm length, while individual 2 has extraordinary long arms. In addition, we can see that individual 2 is wearing glasses, while individual 1 is not. Individual 1 has a perfectly normal spine alignment, whereas individual 2 has a noticeably curved spine. We can also see that the face of an individual 2 is thinner and narrower than that of individual 1. Finally, we can note that individual 2 has a very flat feet compared to individual 1. What are the differences between these people? Why are their physical traits so different? And more importantly, how did this happen?
I had people looking at me from all sorts of angles. Since I was pretty small, so I'm pretty used to, being in the spotlight a lot. They diagnosed me with Marfan syndrome. It was very long, very, very long and thin, which was I was always very a curiosity for people. I was a very thin person. And I might have been like the length of other people, but it just made me look thinner because of the way my bone structure is. I've always been looked at all the time. I mean, I guess I'm really used to that. I've just been being in the spotlight and just being asked questions about my hands and my bone structure and stuff.
Hello, I'm from the Foundation, America's Plan to Ban Marfan, and today we'll take a look into the genetic disorder Marfan syndrome. Marfan syndrome was first described by Antoine Marfan, a French doctor that noticed this disease in a 6-year-old girl in the year 1896. Marfan syndrome is a disorder in the connective tissue that affects the skeletal system, cardiovascular system, eyes, and skin. For example, the excessive growth in the bones of the affected body causes very tall height and lengthy arms and legs. Other common symptoms, some of which shown in individual number 2, include a chest that sinks in or out, flat feet, crowded teeth, hypotonia, overly flexible joints, a learning disability, smaller lower jaw, scoliosis, and a thin, narrow face. Effects of these symptoms can include affected lung tissue, the weakened aorta of the heart, problems associated with the eyes, and the skin and tissue coating of the spinal cord. But why does this happen, you may ask? Let's talk to Dr. Beck again.
Marfan causes a defect in the gene FBN1, located in the 15th chromosome. These defects cause problems in the production of fibrillin, a special type of protein that plays a major role for connective tissues. This is very bad because connective tissues is found everywhere in the body and supports the organs, blood vessels, bones, joints, and muscles like a glue. Therefore, those with Marfan syndrome have a weaker body parts because the glue or the connective tissue is weaker than normal.
In the United States alone, more than 200,000 people, men, women, and children of all races, are affected by Marfan syndrome. That's 1 in every 5,000. Today, we're going to be visiting a family and how they deal with their child having Marfan. Hello. Come in. Thank you. Please sit down. The Doe family live a normal life in Richmond, Virginia. Colleen Doe is a single mother raising 2 girls after her husband Jeff died 4 years ago. Colleen's daughters were only 2 and 4 years old at the time.
Jeff was not aware of his condition, and therefore he was never treated. His parents and doctor just assumed his long bones were merely a physical characteristic. At the age of 8, in the middle of a soccer match, the ambulance had to arrive when Jeff experienced extreme heart pain. I was there. We were childhood friends. Through our teen years, he had multiple health-related issues, as well as being bullied for looking different. By the time we were adults and were married with 2 children, the doctor discovered an aortic dilation. This ultimately caused his death. I'm sorry.
What we know is that Jeff inherited the disorder from his father, who did not inherit it from either parent. This is because 75% of the time, Marfan syndrome runs in the family, and the other 25% of the time, a mutation in the egg or the sperm occurs. That is why Marfan syndrome is considered a genetic disorder. The cause of this mutation is still unknown, but after being born with Marfan, the person will have a 50-50 chance of passing it on to their offspring. For Marfan is a dominant trait carried on by the gene FBN1.
Please tell the viewers at home how Marfan affects people in their everyday lives.
Generally, people with Marfan live normal lives. However, they do have to receive treatment and follow medical advice, like my daughter Sarah. If she was not treated, heart problems would potentially lead to sudden death. The hardest part for Sarah at this point of life is she's not advised to participate in sports such as basketball, football, or even soccer because of her quick fatigue, shortness of breath, and heart problems.
My life is pretty normal, I guess. I mean, I can do basically everything except for sports. My twin sister, Caitlin, is a basketball star and a real big deal at school. She's won tons of games and taken her team to state. I can't play sports because of my heart. I mean, I guess that's fine. Mostly I stay at home while Caitlin is out playing basketball. I mean, that's okay. I draw and I love art, and I guess sports just isn't for me.
Thankfully, Marfan syndrome is diagnostic. People who have the ability to determine whether or not a person has Marfan syndrome include geneticists, specialists, cardiologists, ophthalmologists, and orthopedics. A geneticist finds out about family members who have experienced similar symptoms in the past and who have died of heart-related problems. The specialist takes painless tests, for example, skeletal measurements of the arm span. A cardiologist will perform also painless exams, like listening to the patient's heart. An ophthalmologist will dilate the pupil of the eye to help diagnose eye issues. And an orthopedic will scan for curvatures of the spine and breastbone, joint troubles, and other bone defects.
For teenagers like me living with Marfan syndrome, they have to be monitored closely by a team of specialists. I need constant eye and bone exams, and recently I had a screening for scoliosis and found out that I tested positive. Now I have to wear a brace for my back. In addition, if my eyelids become seriously dislocated or if any other complications appear, I might have to have surgery. As for my heart problems, medicine is used to decrease my heart rate to help prevent stress on my aorta. Past surgeries replaced my aortic root and valve. Also, I had a couple dental procedures because of my crowded teeth.
Marfan syndrome is a potentially fatal disease. However, life expectancy for those with it has increased dramatically over the years. In fact, from 1972 to 1995, life expectancy increased by 25%. The probability of survival had risen from 49 to 74 years in women, and from 41 to 70 years for men. Currently, Marfan syndrome is without a cure, but we, as America's plan to ban Marfan, have 2 goals. 1. To build awareness. 2. To find a cure.
I just want the public to be more aware of Marfan syndrome. By building awareness to this disorder, it can lead to advances in research and technology to better the lives of those who already have it.
Help from you, the viewers at home, is essential to accomplish our goals. Through your donations, we look forward in advancing our research and to have the general public more informed about this topic, as well as to know that this is serious. Current research being done include reasons that cause problems in heart and blood vessels, Factors that lead to skeletal problems. The chemical messenger TGFB. Genes that are linked to Marfan syndrome. Families with the Marfan syndrome gene. The effects of Marfan syndrome on the connective tissue. The different cases of Marfan. New treatments, medicines, and surgeries for those with Marfan syndrome. Build awareness. Find a cure. Donate now at 1-800-622-MARFAN.